Okay, thank you very much, Priya, and everyone, and all of the speakers that have set this discussion up so well. I think that's really important. Thanks, Priya, also for the promotion. I'm actually just a lecturer still at the moment, but certainly working my way there. All right, so I'm speaking to you today from Turrbal Aboriginal Country in Meanjin. I'm attending another symposium at the moment as well, so I'll be rushing off there after this. But I wanted to say that I really hope that the excitement that we feel about this project is infectious, and we really believe that this project has the potential to transform the way we think about professional practices in health. So today I'm going to talk about the UNICEF Strategy for Health 2016 to 2030. I think it provides a really useful counterpoint to the models developed by Fawcett and Ellenbecker that Natalie touched on a little earlier. And I was also really mindful while Professor Chow was speaking of how well this model applies to the vision for nursing that she set out so eloquently. I should also point out that I do not work for UNICEF, and the model and the examples that I'm presenting today are the result of a desktop review of UNICEF planning and evaluation documents, although I'm really interested in following this up further. The model itself, the UNICEF model, which you can see on your screen to the right, can be applied to our project by providing pathways for action around the upstream social determinants of health. The program of action developed by UNICEF is primarily aimed at community health workers, not specifically nurses, although community health workers is a really broad label and certainly does include community nursing and community health promotion and promoters and community health volunteers as well. Firstly, I'd just like to point out the three approaches towards the top of the table: the need to address inequities in health outcomes, strengthen health systems, and promote integrated multi-sectoral policies and programs. All of these can be really interlinked with the upstream social determinants. They provide a really good range of intermediate goals that we can aspire to achieve through our work. However, it's the actions underneath these that I think we are primarily interested in today. So these actions are grouped into advocating for every child's right to health, influencing government policies, strengthening service delivery, and empowering communities. So just as a case study, I'm going to focus on the Kenya WASH program. That's the Water, Sanitation and Hygiene program, which was delivered by UNICEF and over the past decade or so. And I'm going to consider how the UNICEF strategy actions have been employed. So the UNICEF documents are really helpful in providing a detailed upstream social analysis and the interlinkages between those determinants. The UNICEF model is also really useful in working across a range of different settings, different income and resource levels, from emergency situations through fragile and low capacity to medium and high capacity countries and regions. Just as background, the UNICEF Kenya WASH program aims to improve access to clean water, sanitation and hygiene in some of Kenya's most underserved communities. The 2017 Kenya Situation Analysis showed how WASH is central to improving health outcomes, with poverty, housing, and education acting as interconnected factors. And these are really explicitly set out in the UNICEF documents. But these upstream self-determinants themselves are interconnected in complex ways. Inadequate housing, especially in informal settlements which lack basic infrastructure, leads to unsanitary conditions that worsen health outcomes. Poor access to clean water and sanitation exacerbates poverty by increasing illness and healthcare costs, particularly in substandard housing. Education is also linked into poor water quality and sanitation issues, as children, particularly girls, miss school due to poor sanitation facilities or the responsibility of collecting water, which further limits their economic prospects and perpetuates the cycle of poverty. Community health workers in the WASH program play a critical role in advocating for health equity by firstly collecting data on waterborne diseases, sanitation and living conditions, And this informs policies that can then directly improve water access and housing. Community health workers also collaborate with local governments, schools, and NGOs to address interconnected issues like housing, poverty, and education. By helping to secure funding for improved water infrastructure and sanitation, community health workers then can enhance living conditions and reduce health burdens. In Kenya, for example, their focused advocacy efforts have successfully led to an almost $1 million commitment towards sanitation and hygiene improvements across the 3 countries. Applying this part of the model to nursing specifically, we can see that nurses can expand on their own roles by using patient data to push for policy change, increased resource allocations, and improvements in living conditions, access to education, and poverty reduction. I actually know personally a nurse who spent an entire day at a veterinarian's office taking care of a homeless man's cats just to help him get his own housing needs sorted out before then she could go on to start addressing his health needs. It's a really potent example of how different kinds of activities can actually improve health. The next component focuses on influencing government policies through evidence-based approaches, scaling up interventions, and sharing key knowledge. This map from the Brazil UNICEF Trilateral South-South Cooperation Program shows how health and nutrition programs developed for use in Brazil have been shared and adapted internationally. Actions by community health workers have been used to improve health services and policy adaptation in those partner countries. Like community health workers, nurses can use data, help scale up health interventions, and share knowledge to drive evidence-based policies and improve healthcare outcomes. The third action area is strengthening health service delivery, and we can also link this to the WHO's health system strengthening building blocks. The Kenya WASH program strengthens service delivery through capacity building, training community health workers and local managers to sustainably implement services, particularly in areas affected by waterborne diseases that are currently underserved. The focus on community-level service provision ensures access to clean water and sanitation, while strengthening supply chains can improve the delivery of essential materials at the right time. Likewise, nurses can address upstream determinants of health by advocating for improved transport infrastructure, affordable medicines, universal health coverage, and addressing things like low wages and welfare payments. These factors are really critical to the WHO building blocks. Better roads, transport, advocating for universal healthcare improves health financing, advocating for fair wages and reducing medicine costs enhances access to essential medicines. Critical to this is developing leadership skills among the nursing profession to undertake broader change.
My apologies, Albie.
Okay.
We are nearing time because
That's fine. I've got one more slide after this.
Yeah.
So the last of those 4 approaches is the empowering communities, which is all about building local capacity to make health programs sustainable. They focus on promoting social and behavioral change, working with communities to shift health-related norms, like reducing the stigma around mental health and HIV/AIDS. A big part of this is also about generating demand for health services, educating people about their rights, and breaking down barriers to access. And these were the boundaries that Professor Chow mentioned earlier. So just to wrap things up, looking at the key implications for nurses when it comes to addressing upstream social determinants of health, advocacy for health and other rights is one of the most powerful roles that nurses can take on. With the data they gather from patients, nurses can advocate for improvements in housing, education, and other policies that address the root causes of poor health. Influencing government policy is another crucial area. By working closely with policymakers, nurses can ensure that health policies are grounded in evidence and address upstream factors. Nurses can play a critical role in strengthening service delivery, advocating for better infrastructure, medical supply chains and broader health coverage. And community empowerment is a really important area where nurses can have a lasting impact. So like community health workers, nurses are often deeply embedded in their communities and can lead initiatives that promote education, economic and social empowerment and leadership. So what I'd like you to take away from this is an awareness of the complex interplay between upstream and downstream factors that influence health. Working upstream can lead to downstream changes, while nurses should be aware that upstream outcomes of their downstream activities and the kinds of actions that strategies that nurses might employ in moving their practice upstream. So in this project, what we're really hoping to do is to gather case studies and stories of how nurses have worked with the upstream social determinants of health, consider those complex interplays and develop a set of guidelines that we can use to build our understanding of how we can move our